Personally, I think that dysmenorrhea is among the top three most difficult things about being a woman. So it's a serious deal, you know that. And that is why I want to talk about it today. Now, dysmenorrhea is simply a medical term for painful periods or menstrual cramps. Okay, if you hear dysmenorrhea, that is a foreign name. A foreign name for menstrual cramps. We have two types of dysmenorrhea or menstrual cramps. We have the primary dysmenorrhea and the secondary dysmenorrhea. A lot of times people talk about how painful their period cramps are, but what they don't understand is the type of period cramps that they are experiencing. When you talk about primary dysmenorrhea, it is just the normal one that we experience either as an adolescent or as a young adult. And this primary dysmenorrhea is caused by increased production of prostaglandin, which causes the uterus to contract, and that is the pain that you experience during those contractions. But when we talk about secondary dysmenorrhea or secondary menstrual cramps, these ones arises as a result of underlying medical conditions. Okay, it could be as a result of uterine fibroids and then you're having the severe pain. It could be as a result of endometriosis. It could also be as a result of pelvic inflammatory diseases or even urinary tract infections, and you're feeling this stinging pain. It is usually caused by something. It doesn't just happen. So you need to understand the type of pain you're experiencing, whether it is primary or whether it is secondary. If you understand the type you're experiencing, it would help you to make the right decision concerning it. What I mean is, you will really know what you're going through and you know how to handle it. So if you're experiencing a severe kind of pain that you don't seem to understand, I don't think you should just relax and think it's ordinary. Yes, it might be ordinary, but in most cases, it could be as a result of underlying conditions, which you need to find out. If you're still watching this video up to this extent, I am really so grateful. Please just give this video a thumbs up so that the algorithm can push it to some other people who might find interest in it. Thank you. I better say that not all women experience menstrual cramps. I mean, glory on their behalf because I cannot relate. I cannot relate to what it means to not experience menstrual cramps. So I think I need to thank God on their behalf every single time because they are enjoying. Now, menstrual cramps usually begin 1 or 2 days before your period. It could begin during your period, okay? And you usually feel the pain around your abdominal region. That's where you are likely to feel the pain. And most times you can feel it at the lower part of your back. And you can also feel it at your thighs. I mean, that one is more crazy because most times it is as though a heavy stone is tied to your laps and you can't even walk. You can't run. You can't run. Okay, these are where you're most likely to feel the pains. For primary dysmenorrhea, the pains are usually episodic. What I mean is, it's almost synonymous to that first stage of contraction that you experience during labor. Like the thing just comes and bites you and goes back and bites you again. So that is how it is. It comes, it goes, it comes again. But then for secondary menstrual cramp, the pain is usually severe. I mean, very severe. And it can last longer, and most times it also comes with a heavy flow. I mean, a very, very heavy flow. So if you experience a very severe and excruciating pain during your period, then you should suspect secondary dysmenorrhea. And all you have to do is just to visit your gynecologist. And you should do that as soon as possible with comprehensive history and physical examination. Your gynecologist can be able to tell you the cause of your severe painful periods, and in most cases you might be asked to go for a pelvic ultrasound, a laparoscopy, or an MRI scan. Okay, now how do you treat or handle painful periods? There are over-the-counter drugs that you can just simply take and the pain will be gone. Drugs like ibuprofen does wonders. But for somebody like me who is scared of taking drugs, I think ever since my period years, I have not taken drugs for painful periods more than 10 times. Yes, I've not done that more than 10 times. It's less than 10 times. And the few times I did, what I took was Felvin that was recommended to me by my friend, and it really worked. So because I don't like taking drugs, I had to take my time to curate some homemade and natural remedies that has been working for me, which I am going to be uploading the video by next week to show you some homemade remedies that you can use to tackle period cramps. And I am going to try as much as possible to list them all for you, the ones I have tried, because I cannot list what I've not done before. And I'm going to tell you how they worked for me, how they worked in my body, and the resultant effects. Okay, so that is it for drugs. Another way you can tackle period cramps is through the use of hormonal birth control. This hormonal birth control helps to regulate the menstrual cycle and to reduce pains. Okay, and most times you will even be looking for your period and sometimes it comes as tiny drops, like it reduces the pains over. If the cause of your painful cramps is secondary, now depending on the underlying cause, you might be placed on antibiotics, medications to shrink the fibroid. That is, if it is as a result of infection or uterine fibroid, you might even be booked for a surgery. Okay, if it is a situation that warrants a surgery, as in the cases of endometriosis and fibroid, you really need to do something very, very, very fast about it. You need to see your doctor as soon as possible. Thank you so much for watching this video to this extent. I am really very grateful. If you're yet to subscribe to this channel, please do well to subscribe, like this video, and share it with your friends. And if you're a lady who has been experiencing period cramps, I would really like to know what your experience has been so far with period cramps and possibly how you've been handling it, and if you're really making progress with the way you've been handling it. Okay, thank you so much. Bye.